So next we call Dr. J.K. Reddy, who needs no introduction in KSOS. The use of diamond bar managing recurrent erosions and pterygium.
Good afternoon. This is a good old instrument, but somehow is not much used in ophthalmic practice. It's a very useful. Even I didn't use it for the past, maybe I'm practicing for 30, 40 years, 35 years. So I never used it. Now I started using for the past 10 years. It's an excellent instrument. So I want to popularize. No. Yes, okay. Yeah. Some version problem. So the diamond bar used in ophthalmology. I suggest everybody who enters ophthalmology buy one bar. This only just costs 10,000 rupees. It's a wonderful instrument and it makes wonders. So this is a simple one. You got a motor, you got a battery, everything in this, and you got a tips. And the tips there are two tips. So the R means rough, F means fine. That's all. This is a diamond. The small ones, 1 millimeter is not diamond. 1 millimeter, 0.5 millimeter is a carbide tip. So, but still you can say diamond. Diamond is always, diamonds are forever. It's very interesting. I had 10 diamond knives in my early cataract surgery. Still I'm having them. So I like diamonds. They're forever. So this they give a small thing like this. From this you have to choose it. Choose 2 millimeters F. That means fine. You don't need a rough one. Rough one is rarely used. When you are buying that, you buy that with the one. You can buy even 2 or 3. Each one they charge around 4,000 rupees. So this is the video showing how you use this one. This is the one, and you unscrew it. You got a battery. You have to know this. You have to battery because during COVID times. We never visited hospital for 1 year. They kept it like that. The battery. I lost 2 diamond bars. All became battery leaked and motors are all gone. I had to buy a new one. So when you are not using for a few months, for example, you go on a long trip, something like that, remove the battery and keep it. If you leave the battery, it will drain and you will lose the. It's only 5,000, 6,000. It's not a big money, but still it's a waste. So this when you turn fully, it will rotate. When you a little bit unscrew it, it will stop rotating. That's the contact time. So pterygium, this is a pterygium. You see that is coming to the pupil area, and you try to cut with the blade. It's gone. It's gone. The anti-surface of it's not the clean cornea that is important. It is the surface quality of the cornea that is important for vision. It's not the clean looking cornea like a glass. Even in that surface quality. So you just peel off pterygium, whatever left tissue, you can nicely use the diamond bar even in the pupil area and make it very smooth. You get a very nice post-operative vision after cataract surgery. Wait for 6 weeks. Even with the pterygium onto the pupil covering entire thing, you get excellent results if used. I recommend every case of pterygium use diamond bar. Don't do any pterygium without diamond. And patient also likes it. You say I am using diamond bar in you can charge few thousand extra. There will be diamond means this always a value. A little bit opacity, the corneal opacity, don't worry about that. You get a very nice surface. Then RC, this is a beautiful one. You need to recognize where the RC is. See in slit lamp examination. And OCT, they say you can see RC, but we find very difficult to see it. So you see slit lamp examination, you can see RCE where it is. And it's a very simple thing for ophthalmologists, for very distressing for the patient point of view. For example, this patient is a bit complicated one, right involving the pupillary area, and it's a post-LASIK case. She got operated for LASIK for marriage, and she has to postpone her marriage because she is not able to open her eyes. So after 3 months she came to us. There are microfolds, everything it will disappear. You can see the LASIK flop here. Nothing, no need to worry at all, absolutely. You can do with the diamond bar even up to the periphery, which you cannot do with excimer laser. Excimer laser you can do only 8 millimeters. You cannot do for 11 millimeters. In diamond bar up to limbus you can polish it and they do very well. For example, you can see the flop. She is doing exceeding well. After 1 month she got married. So sometimes just empty your mind. Don't think about anything. You find the patient, you see how you can help the patient and think about it and find your own way. Thank you very much.
Thank you, sir. I have one doubt. How will you sterilize this diamond bar?
Yes, because a small talk I didn't give it. The first one is you have to just, you cannot sterilize it. You can sterilize by using EO gas, the diamond bar, the main unit with the battery all, but it's not necessary. You can just use alcohol. That's we call it disinfection. We don't call it sterilization. Alcohol and wipe it off once or twice, two times. And the tips can be autoclaved. The tips you can autoclave and pack it and put it in the tip. This is not called sterilization. This disinfection, sterilization, both combined use.
Okay, any doubt since sir is leaving? Any doubt you can ask now?